Well, as we've already established by the first panel, healthcare is that weird cousin. Healthcare is something that can it be radically changed or can it be adjusted? It's like the crazy person in the room. One of our earlier panelists said, you kind of have to live with it and humor it and change it slowly. But this panel is about disruption, and we're going to perhaps challenge that a little bit, or at least think about the best ways that things might be disrupted. Who is the customer or the end user that we're targeting? If we talk about payments transformation through disruption, is that the government? Is that the insurers? Is that the individual? If it's about health delivery, are we talking about a hospital system and a clinic system? If it's about patient security and health, is it ultimately about disrupting a consumer system? So let's go down the line addressing what you think of as the system and the parts that are most regulated and in need of change, and talk about your own relationship to that, okay?
I want to take a little step back and just talk about innovation and disruptive innovation. A lot of people are not real shocked to find out that at the Institute for Disruptive Innovation, we talk disruption all day long. But here, especially in Silicon Valley and San Francisco, the Bay Area generally, we want to stick the name disruptive on everything that is fun, new, innovative, shiny,
it's
trendy,
inherently positive here.
Anything.
Yeah.
It is.
And it's good.
But not all innovation is actually disruptive. And so I think we want to be careful as we talk about disrupting the system about what disruptive innovation really is. And so there are a lot of things that are innovative, new, breakthrough, big innovations that are actually, we would call them sustaining in nature because they're better than what's already out there. They're new technology, but fundamentally they're often more expensive.
Can you give us an example of what a non-disruptive innovation might be?
Sure. So, most of our Apple products, frankly, but you know, they are newer and better and more sophisticated devices, computers, you know, the new
okay, so
new
like
iPhones,
the iPod
things like that.
is basically
kind
an
of next
MP3
generation
player with
products.
a better user interface.
Yeah.
Okay.
Next generation products are often sustaining in nature. Disruptive products are characterized by technologies that make things, products, services more affordable and more accessible. And one of the tricky things about disrupting in regulated industries is that coming up with less good, more affordable products and services is really restricted by regulation. So back to your original question about kind of what is the healthcare industry, right now it is a system of kind of misaligned incentives, largely controlled by the government, love it or hate it, that is really restricting our ability to disruptively innovate. There's a lot of places to go up, you know, new technologies, new treatments for health problems, but to disruptively come in at the low end of the market and make products and services more acceptable. I mean, we're still trying to be successful with healthcare in the US, so I think it begs a lot of questions for us in terms of, you know, our regulatory environment. And we don't see, you know, I wish I could rattle off a bunch of success stories of great tech that has beaten our regulatory problems. But right now we only have a few kind of examples of what we do about this. Ideally, you know, we could, well, take a step back. So you see it in a few places. You see, for example, retail clinics have exploded all over the United States. And those started in states like Minnesota, where nurse practitioners had a little more autonomy, according to local regulations, to be able to write prescriptions. And for a very limited menu of medical problems that we understand very well, I can stick a Q-tip down your throat and figure out whether or not you actually have strep throat, and if so, prescribe antibiotics. Very straightforward. And you know, as retail clinics prove that they could be successful and actually provide good, convenient healthcare without hurting people, which is an important part of the conversation, you know, then you could actually begin to change the regulations in other states that have allowed the proliferation of retail clinics. And so finding opportunities kind of at the edges, not hurting people is important, but at the edges of kind of beyond the limits of regulation or beyond the reach of regulation, and being able to prove that something works, has worked. You see some new technologies being deployed within integrated systems where a payer and provider like Kaiser are aligned and can actually work around some of the payment restrictions and say, well, actually, If a nurse practitioner is just as qualified as a PA to do this procedure, we'll have the more affordable PA provide the procedure, and they can actually make that decision, whereas in situations where payers and providers are not part of the same system, a lot of the providers are really restricted in what they can do by how they can get paid. And I think that payment thing, sorry.
No, go ahead.
I think the payment question is what's really limiting us, is right now we get healthcare where we can get it paid for. And with a lot of technology and kind of changes in the healthcare system happening outside of our country, because we regulate a lot away from us, a lot of the opportunities seem to be emerging internationally. But then we have limited control and understanding of the quality. And so I think that begs a really interesting question for us, is how much do we want to let go of? The limiting factor, I think, is not just the innovations. I think the US will continue to be innovative. I think there's incredible technology emerging all over the world, but there's a lot of really great innovations that are made technology and healthcare more affordable, and certainly in the process of which more accessible, but they have failed in getting traction in the US because they don't get reimbursed.
And just free associating, how hard would it be for a foreign developed system from an unregulated market be to enter the US healthcare system in a mainstream way?
I mean, it's almost impossible. It depends on what you're talking about, right? If you're talking about a $5 device, people might pay out of pocket if it serves a purpose that they actually are looking for. In a lot of cases, what you're talking about is things that you want hospitals to buy or payers to reimburse for.
Right.
And in the near term, the U.S. may not matter in the long term.
$5 devices,
but
no one will care.
in the near term, with devices that are hundreds of dollars and thousands of dollars, that gets no traction, or it gets forced into a CPT code where you're charging a different,
Okay, so
a different reimbursement rate.
So to go to the classic,
regardless of what
somewhat
the
clumsy
price is.
metaphor, it's like little redwoods that grow up around the big one and eventually just
Yeah.
the big one
I
doesn't
mean, there's a
matter.
lot of great devices that are cheap that we pay through the nose for.
Let's talk about this in the context of a broken arm or heart surgery or something people associate with real medical care. What does that look like? Because that isn't cheap and easy. That's people, machines, critical timing. You know, what kind of disruption takes place in those contexts?
I would say those are actually some of the last disruptions to happen. There's a lot of kind of lower hanging fruit problems, but fundamentally, if your arm is broken or your appendix has burst, you need a clinician to be there to, And so in terms of, I need a prescription today, I need an antibiotic, I have, day-to-day clinical problems, those will get disrupted a lot sooner. I think it's actually a really interesting question. We've got a lot of bright minds in this room. One of the things that we've been working on wellness programs and talking prevention for a long time, but one of the things that we fundamentally don't understand is what motivates people. And we target wellness programs and staying healthy and taking care of yourself. We talk about it like it's important, but fundamentally, day to day, a lot of people just won't take that responsibility. And so if someone can figure out a business model where we get into people's heads and understand a little better what motivates them and create a business model where we're actually, aligning with people's jobs to be done, so to speak. We all have jobs to be done, and fundamentally, we have things that we want to accomplish. And most of us don't think about our health very much until we have an acute event, we're sick, and we actually need health care. But there is an extensive amount of literature that talks about kind of these problems of taking care of ourselves, acting more nobly, to your point. But no one's really figured out a business model that gets to us early enough that changes the incentives for us. Okay. We know we should act better, but we don't. So we got to do something different. I'd say another one that is also fairly obvious, of course, is safety. And that what emerges, part of what keeps a lot of people seeing their doctors in the U.S., even if technology provides cheaper options, is that that they've gone to medical school and they have a certified certain amount of training. As especially in the near term, as a lot of these technologies emerge, we just don't know what we're getting. And as companies continue to exist, there is, records of safety and things like that that'll give us confidence. But I think there's an important role for our government and maybe an international regulatory body to be thoughtful about the kinds of care we're receiving.